Patricia Paddy is just back from Uganda, where she's been working with an organization that Crossroads Relief and Development partners with to help improve maternal mortality in Africa, called Save the Mothers. We're so glad to have you here.
Thanks, Cheryl.
Welcome back. I know you're just kind of getting over jet lag.
Yes, but it's getting there. They say it takes about a day for every hour.
I know, it's about a week, isn't it?
Yes, yeah.
It's crazy. Well, hopefully I'm not too much, you're not seeing me in a fog or with that light surrounding me. I know what that's like. I lived through that many times.
Yeah.
And you were there basically looking at this work that we're doing to help save moms. And, you know, in Uganda, it's particularly intense. I think it has the same population as Canada, approximately. We lose about 50 moms a year. They lose about 6,000. Like, the disparity is huge.
That's right, Cheryl. And about 100 years ago, here in Canada, maternal mortality was an issue for Canadian women as well. But we have our medical system has come so far, and our doctors and just our societal structures have really progressed to the place where you know, women don't die in childbirth here anymore. And 15% of all pregnancies will result in a life-threatening complication. That doesn't matter if you live in Canada, if you live in the US, if you live in Great Britain, or if you live in Uganda. 15% of all pregnant women will develop a life-threatening complication. But the reason so many more women are dying in Uganda is because they don't have access to the help that we do here in Canada. So they're preventable deaths, and that is where the great tragedy and the great injustice really exists, is that these deaths don't have to happen.
Exactly, and it's kind of the will of society. I know a lot of women go to a traditional birth attendant. You brought a picture, actually, of a woman waiting. So describe what that's like and what we're seeing in this picture.
Okay, so this is a woman we visited one day the home of a traditional birth attendant in northeast Uganda. And 50% of all women who deliver in Uganda do so without any skilled help whatsoever. So that means no doctors, no nurses, no midwives, no doulas, nothing. What they do have is oftentimes a traditional birth attendant who will typically be an elderly lady in the village who has helped a lot of the local village women give birth. And the day that we visited the home of this traditional birth attendant, she wasn't there when we got there, but this woman was sitting outside her door, and it was an excruciatingly hot day. This woman was in labor, and she had walked 4 kilometers to get to the home of the TBA, and then was just sitting down outside the door of the TBA's home waiting for help to arrive.
Wow, and I know sometimes if they get in a critical situation, it's not good. Sometimes they give them teas that aren't good, that can actually threaten their pregnancy. So there's a lot of kind of old wives' tales. As well, you went to go see a major hospital in Uganda, which you would think that would be like the best of the best, but that hospital is really overcrowded and overrun. We have a picture actually of women on the floor. I saw this myself. It's quite shocking. Tell me about it.
So this photo is of sort of a makeshift postnatal ward, and all of the women in this photograph delivered either just minutes or a couple of hours earlier. And the hospital literally has nowhere to put them. So they deliver their babies, they're whisked up off their bed, and they're taken out into another room, sometimes a corridor like this, where they're allowed to lay down for as long as it takes for them to recover. But there are no nurses monitoring them. All they have is each other.
It's dirty. I've seen it. It's just, it's so disturbing. Yeah. And you actually were looking for one woman because you met her husband. Quickly tell me that story.
Okay, so when we arrived in this hospital, there was a gentleman standing right outside the labor ward waiting, and so we struck up a conversation with this man, and we learned that he had been standing because there were no seats since 6 o'clock the previous evening. He hadn't had anything to eat. He was worried sick about his wife, who also he knew hadn't had anything to eat, because the hospitals there aren't like the hospitals here. They don't provide food. Your relatives have to bring it in for you. He hadn't been able to give his wife anything, so he was very, very concerned. His wife was in labor. She was waiting for an emergency C-section because her baby was lying transverse lateral, which means across, so it wouldn't deliver normally. So we went looking for his wife, accompanied by Dr. Eve Nakabembe, who is an obstetrician and gynecologist in this hospital. And we went into the labor ward. His wife wasn't there. So nobody knew where she was. Nobody knew her name. Nobody knew where she was. There were no files, no charts. So we went searching throughout the hospital. And after about a 30-minute search, we managed to locate his wife. She was laying on the floor of the critical care unit, where where women were in various states of distress and labor waiting to deliver. And unfortunately, she was not going to get her C-section because the hospital had run out of water and linens, so they were no longer performing surgeries. So there were a number of women that we saw in this critical care unit whose babies had already died in utero because, like this woman, they were waiting for emergency C-sections and the hospital couldn't do them.
We are really trying to work very hard to change this kind of situation. And people like Patricia help us tell the story, because the story is not known in many parts of the world. The risks that we get in pregnancy and childbirth and the kind of care. Like you see now, you're all on the floor, and yet this section is for people who have severe complications. Like people who have severe complications, elevated high blood pressure, their babies have died in utero, they're leaking a lot of liquor. In other words, they need a very critical eye. But how do you give a patient critical care when they are on the floor like this? How do you even start? How do you even start?
I think it's incomprehensible for us to understand. We're going to be bringing you more about this the first week of June. We're going to focus an entire week on this issue and what we can do to change it, because it is changeable, isn't it?
Absolutely, absolutely. These are preventable deaths, and it takes change at all levels of society, Cheryl, but that's what Save the Mothers is doing. Save the Mothers is working in partnership with Crossroads. We're so grateful for your wonderful partnership and support to bring about the kinds of change that will prevent women from dying unnecessary deaths.
Well, thank you for all that you do. And if your hearts have been touched by what you've heard just in this brief time, which I know was so quickly, call the number on your screen or go to 100huntley.com, crossroads.ca, either of those websites, and you can learn there how to make a difference. We'll be telling you more, but thank you so much for listening and just being a part of what we're doing to help improve lives of moms around the world.